We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you. Welcome to I Be Determined. I'm your host, Michelle Harvey.
I'm your host, Mason Harvey.
And I usually discuss things from the role of a caregiver. I'm also Mason's mom.
And I have Crohn's disease.
And today's topic was highly requested, actually, on the Facebook groups I'm in. And it's something that's often talked about. And I think it's something that you don't have to have IBD to relate to.
Yeah,
Anyone
can relate to this.
So today's topic is going to be about the fear of needles. In studying this, so Mason and I learned a little something here. So there's a term for this. And the term for it is, and do you want to try to pronounce it, Mason?
Trypanophobia.
I think that was really good. I think I got it.
Yeah,
but trypanophobia is the word. And that is the fear of needles. But specifically, it's the fear of getting an injection or a blood draw. So it's not necessarily, there's another term for just being afraid of like a needle.
And you don't like just seeing it.
Yeah, that's a different phobia. But this one is in relation to having a medical procedure that involves needles. Like, why is there a fear of injections?
I mean, they hurt.
Right.
I think it's an obvious answer.
Yeah,
it's an easy answer.
They hurt. And when you are old enough to recognize that these are painful, you don't look forward to them.
You don't like them.
And I remember Mason, he was
hated them.
Yeah, he was like 4 or 5. He had gotten a series of injections, just regular ones that all kids get, nothing pertaining yet to IBD. He was not diagnosed at that time with anything. So this was just a regular vaccine checkup. And they told him, the nurse was like, well, we'll see you when you're 11. And he was like 5 years. Yeah. He was like, what? See me when I'm 11?
11?
Yeah. She's like, yeah, for your next set of injections. He was like, like, oh my gosh. And what did you do?
I counted every single year that went by.
He did.
Like, it was 5 years, which is a long time. I think it was like 5 years or 6 years. I'm not sure.
Yeah.
But it was a long time. But I counted every single year.
And I think there's a lot of adults out here who are also scared of these, having to get a blood test.
Who isn't scared of
IV? But so, I mean, it's kids can relate to this and adults can relate to this. And from a caregiving aspect, it is something that we enforce, and we have to figure out how to be a support system for you guys and for ourselves too. And for anyone, adults might need someone to hold their hand too while they're getting these. So
everyone can get some help.
It's a good topic. So something good to discuss. In researching this, we looked up a few things. Some of the causes, it could be a traumatic experience you had as a child with a medical illness or chronic illness, and that could have created that fear. And there's also, according to Harvard Health, they're saying that there may be a genetic component to it. So they have found genes linked to fainting after you get a needle stick.
Interesting.
And trypanophobia sometimes runs in families. So that's interesting too. There's a number of reasons that you can develop this, but the most rational one is it hurts.
Yeah.
It's not fun.
I think 2 of the main factors I've gotten so good to needles is that I get them so frequent, I'm used to them, and I know they're helping me.
Right.
Because without them, I'd go into a flare. So those 2 factors have helped me overcome my fear of needles to a point.
It's also important to understand that there is a difference between having a fear of needles and a phobia. And this is not something, again, I did not know this. I just think it's a fear, it's a phobia. But it's interesting because the definition on WebMD is that a fear is something that every single person has to deal with. It's normal and natural to feel anxious about certain things, and especially when it comes to a
Needle,
needle
yeah.
going into your skin. So that's going to be a fear. But a phobia, and some of your kids might have this, some adults may have this, and that's a little more than just a rational fear to the pain of it. So it's technically something have to be diagnosed. So we're not diagnosing anybody here today. We're not doctors.
Yeah.
So that would be on you if you wanted to find out if your child maybe is beyond a fear. If you think it's worse and you think it's a phobia, then you may want to consult with your pediatrician or a therapist and see what they think. The symptoms you might experience if it's a phobia are panic attacks, nausea, sweating, heart palpitations, and fainting. So, and those
are pretty
yeah.
hard.
Yeah, but that's it. But some of people listening might say, oh my gosh, that's what happens.
That's me, yeah.
That's me, or that's my child. So phobias are when someone has an exaggerated sense of danger from a situation or an object. So fear versus phobia.
They're different.
Yeah, because
I didn't know that.
No. So. Well, and I don't want everyone watching this or listening to this thinking that they have trypanophobia. It's important to get a proper diagnosis if that is something you are concerned about. The next thing we're going to discuss is having IBD, which is having Crohn's or ulcerative colitis, and how much that does involve needles. And that's something that you probably listening to, you can relate to this, because probably the first time that, either you were diagnosed or your child was diagnosed, it was you probably had an IV at the time, you probably had blood tests, you probably had a procedure, so you probably did have to be under anesthesia.
It's a hard time.
Yeah, and so it's or even an MRI, you have to get an IV during that as well. You may have already encountered that, and it may have been very difficult. And I think what is more difficult is when you find out that this is a life situation, and especially for a child, and especially for a kid who does not like needles, doesn't like injections, and to hear like this is your life.
This is gonna be here for the rest of your life.
Yeah.
No.
It's tough.
Hey.
That's a really tough situation. It's not temporary, it's not for a few years of treatment. It is for life. And Mason, when he found out that he would be on biologics, we thought, you get to remission, and then he's like, and then I can come off of these, and it's like, no, you can't. Remission for Crohn's patients is different. It does not mean the disease is gone. The biologics treat the disease, they don't cure it. So you have to continue with them. And so that's kind of that's a tough thing. And then you need labs with these. So you're going to be getting blood draws. You're going to be
hopefully you can do them with an infusion. So you don't have to get an extra poke.
Right. Because if you don't do infusions and you do injections, you will be getting labs separately that way too. So it's a lot for anyone to accept and to be okay with. But it's something that is really important to attempt to overcome these fears for your mental health. Like when Mason, when he was diagnosed, the treatment he was put on was supposed to be every 8 weeks. It was an infusion, so every 8 weeks. And for him at the time, that was still like
a lot.
Yeah. He's like, I don't want to do that every 8 weeks. Yeah. And then it wasn't working. So like, we're gonna have to go to every 6 weeks. Okay. And then they're like, well, it's going to be every 4 weeks. And so,
that didn't work.
Yeah. So he's like, oh my, so it just seemed like it kept getting worse. And then when he was moved to the next biologic, that was an injection, which was like, okay, that's pretty cool. Now it's supposed to be every 8 weeks. That was moved to 4 weeks. So then he added the infusion. Now he has to do that. So every 2 weeks.
I got an infusion or an injection.
And labs. So luckily we can couple the labs with the infusion.
Yeah. Lucky for us.
So it's something that was important to be addressed.
And now I'm getting them every 2 weeks.
Yeah.
That's a big jump.
Yeah. As a patient, how from when you were first diagnosed to now, how do you feel the difference?
At first, it was stressful because I knew every 2 weeks I'd get an infusion or a shot or an injection. Nowadays, it's not that big of a deal because I'm used to it and I know it's going to help me.
Yeah, that's a big deal.
In the beginning, it was definitely very stressful, but now it just seems normal.
Right.
Normal for me.
Right. And as from a caregiver's perspective, it's very difficult because this is a rational fear. They're reacting to being in pain.
And in the beginning, it was very stressful knowing that I was gonna have to do that for the rest of my life.
Yeah, that
I
was
was like, oh wow.
right. That was a big deal. And and knowing that too, I'm going, okay, I need to help him because this isn't going to change. This is something that's ongoing. And I don't want him every couple weeks to have these stressors that are going to cause him not to sleep or to just not be happy in general because he's so focused on the treatment. But it's an important job for caregivers to find a way to comfort and to validate their feelings, not to demean anybody and act like, just get over it. Never ever do that. It's like, understand what they're going through, what they're processing, and be a support to them. And I think that's the biggest thing, validate their feelings and understand that this is a logical fear, but also understand that you have to be able to help them get through that so they can overcome that
Fear.
Yeah.
Or phobia.
It's important to address. You can't just really let it go. So that's another aspect of this disease that isn't probably talked about too much, is just overcoming this kind of fear. This is just one detail in all of it. So some of the ways to overcome this fear, and again, not doctors. I think you guys all know that by now.
We're not doctors.
No, we're not. So we're going to share with you, though, basically this is based off our experience and maybe what we've heard from others, but what worked for us. And there's not many studies done or proven ways to treat this fear. And so it's interesting to me. I'm not sure why. I could probably read further and figure out why. Probably funding. It's probably trying to find funding for it. But there's not a whole lot. So if you look it up, it's kind of like, well, what do we do? One of the things that helped Mason was rationalizing that this will help him. Because of his age, we're able to say, this is going to help you. Now, there are some younger kids who get
that
this.
won't understand it.
That will not understand that. So that's not really going to work. But if they're at an age where
they can understand
that you're feeling really, really bad right now, this is going to temporarily hurt really quick, but it's going to make you feel a lot better every day, then that goes a long way. And it's difficult when a biologic does fail, because then you're like,
it's not making me feel better.
Yeah, like when he was on Remicade and he's like, it wasn't working. He kept going in and getting these infusions and
they just hurt and they can't really help.
It's just important to remind kids that there will be a reward. This will help you feel better. And also any kind of labs, the testing and anything they need to do also will help you so they know how to treat you better. So yeah, exactly. Explaining how, like, I guess some kids are probably like, why are you taking blood out of my arm? And it's just like, it's
you see your levels.
It's important to explain, right, to see your levels. And it's important to explain why you're having this done. This is all designed to help you. And so that's something important to discuss. Don't underestimate kids either being too young. Just try explaining this to them, and that might help. The other thing that they used in the infusion center was cold spray.
It's a very interesting thing.
Yeah, and I don't know the exact name. I probably should look this up.
Well, we should have looked it up.
Yeah,
we just call it cold spray. And infusion, they called it cold spray too.
Cold spray, right? And it's literally a cold spray, and they spray it on the area,
and it like numbs it. It's like ice. It's crazy.
It's kind of distracting, right?
You said like it's so cold. You kind of focus on the chills. They put it where you get your infusion or a shot, and so like it kind of drives your mind into thinking about the cold and not the prick that you're gonna get.
So it kind of it serves as a distraction, kind of a numbing agent. There was also something else kind of similar that we had. You get it by prescription. It was a Sanera patch. And that, because some people use lidocaine, that's another thing. You could do lidocaine's like a cream that you can get over the counter. It's got a numbing agent. You can put it on the area if you know where they're going to do it. Right, like where they're going to be doing the infusion. That's the other thing. Sometimes they can't get that spot and they have to find another spot. So you've numbed one area, but it ends up not being the area that will work. But if you do have a good spot, maybe if you get to the infusion center before they start anything, they give you a moment, tell you where the best vein is, and you can put it on. But there's lidocaine, there's different percentages of it. Mason did try that. He said it did nothing for him, the lidocaine cream. But we got the Sanera patches, so those were prescribed.
And I said it helped. Right?
You said that helped a lot. And he did have a reaction to the adhesive on
Sticky
it.
stuff. Yeah.
So he got a rash, and we thought the reaction was to the biologic, the infusion, but it was actually just to the
Sonera,
adhesive on the Sonera patch. So we would put Band-Aids, and we would stick the Sonera patch, 2 Band-Aids to put onto his arm. We figured out all kinds of ways around it so he wouldn't get irritated with it, but he could use it. And it takes about 20 minutes, and it gets warm. Like it's like a really weird.
It's really weird.
Yeah, it's whatever the chemical reaction is. We were learning. You're in chemistry right now, so this is like something I feel like we're learning about. I know. They take it off after about 20 minutes, and it's numb, more so than using just lidocaine. So Sonera patches are great.
Good.
And he's kind of graduated beyond those now. He no longer needs those.
Need them.
So that's a good thing. Some of these are temporary. These are like little bridges to get your child, or if you're an adult, to get you through to the next step of acceptance.
Acceptance.
Yeah. So these
Acceptance
are all
of needles.
This helps. These are all things that help. And maybe you'll want to keep using it. And the good thing is you can. This is something you can. The other thing they had in the infusion center was a buzzy bee.
It's just as simple compared to like cold spray or Sonera patches. It's just this little bee, and you put it on your arm, and it kind of like not tickles, but like it makes you kind of like
another distraction.
Yeah, but it gives you a distraction.
It's like a distraction. You don't. So you put it kind of above where they're going to do the
infusion
or
a shot.
Yeah, an infusion. When we say infusion, we mean IV. So an IV is an infusion. It's not an injection. So they put the buzzy bee kind of above where they're going to put the IV in.
And it helps.
So it kind of helps.
Surprisingly.
Yeah. And you could put a cold pack. A cold pack will attach to them too. So you can also get that as far as like you want a little bit of numbing with it too. He would use cold spray and a buzzy bee sometimes. And you no longer need the buzzy bee either. You kind of graduated from that too. So
thank you, Buzzy Bee, for helping me.
and they also they're cute. They have like bugs. They have a few other little designs too. So we bought some for our infusion center so they could have it to use with other kids. So we know how important they are to have on hand, and we didn't want any child to be without one if they requested it. So you're always, that might be a cool gift if you end up wanting to buy a few to take to your infusion center. That's kind of a cool thing that they could use. So
a good way to help out your infusion center.
Yeah. Or you can get one for yourself and you have your own
hospital.
So there's also something else you can look it up online. I don't know the exact name but it's like a shot pain blocker device. It's kind of like a little thing that goes right around where you're going to do the injection. We did try that. It did absolutely nothing for Mason.
It might help someone else.
Yeah. So this just something to let you guys know. It's worth looking up. For him, didn't work, but I do know, I think I've heard in the groups that I belong to, the Crohn's groups that I'm in, that it may have worked for others. So worth a try, worth mentioning for sure.
Definitely.
The other thing is the counting method. We kind of came up with that.
I heard the fact that sometimes we'll confuse the nurses. It works really well.
Yeah.
Because we'll be like 1, 2, 3 to kind of like count to keep your mind off of the pain. Yes. But it's funny because the nurse will be like, "You want me to go on 3 or what?" Because we're just counting, and they don't know what we're doing. And they're like 1, 2. They're like, "Oh no, you can do it anytime you want. We're just counting to keep our
And the nurses that are used to us, they know exactly. They know. So what we did is I kind of created this because I didn't want Mason to hyperventilate because he would get so worked up. And so I was like, okay, I got to keep him calm, keep him breathing. The best way I think to do that is to talk, to count. And so we would look at each other. When you
talk, you have to breathe. Right. To talk. So
we would just, I say, let's just start counting. And we would tell the nurse, go ahead and go whenever you want to. It doesn't have to be on 1, 2, 3. No. Not like that. Whenever you want to go, but we're just going to keep counting. And so we would count all the way from the point they put it in, and they did the blood draw and taped everything down. And so we would just kind of keep counting. And that also really helped.
Something that kind of goes with it is keep your eye away from infusion. Maybe you want to watch it, so what's happening. But I kind of feel like it hurts less to not look at it. But if you want to watch it, you can do that. But
but that's actually a technique that is recommended, is not to look at it. Yeah. Because sometimes that just seeing the needle is enough to scare you.
I try not to look at it.
Yeah. Especially an IV. And we actually got to a point where the nurse showed Mason how they work. And so she just used a pillow and She showed him how an IV works, how they
That's
put
very
the
interesting.
catheter into the vein, and
Obviously, they
yeah.
showed me that after I got the infusion.
Yes, yes, because he was like, at first he's like, I have zero, nope, I don't want to see it. And then later on, when he got more comfortable, she was able to show it to him. And that might be a little unsettling at first, but maybe your child wants to understand something. Maybe
How it
you're an
works.
adult and you want to know how it works. So whatever makes you feel comfortable is what you should do. But not looking is probably the most popular thing, just to not look.
Yeah. It's
And
easy.
so he asked for a warm pack. Usually
They're
they
very
have those.
interesting little things.
Mhm.
They're just little packs, and when you like hold them, you go like this. You crack them and they get really hot. Not
Yeah.
hot, like they're not gonna burn your skin, but it
Right.
kind of warms. It kind of is warm, so it like I don't know how the heat makes the pain go away, but
It seems to
it
help
helps.
you.
Yeah, it helps me at least. Maybe it won't help you, but it definitely helped me, so I recommend it.
Yeah,
But
and they carry those in the infusion
yeah,
center. They have them in the hospital, so these are something you don't have to bring. But if your infusion center doesn't have it, might be worth looking up. So he usually, after
very
it's all
nice.
in, he knows he's going to get a
Heat
warm
pack.
pack or a heat
Heat
pack.
pack.
And something else we also bring is we bring a cozy
Blanket,
soft
yeah,
blanket.
soft fuzzy blanket,
Yeah, they always have hospital blankets. They have, but those, something about having your own blanket and probably something
it
really
feels more
comfortable
like
you can wrap up
comforting,
in. It is kind of like wrapping you in a hug. So
You
that's
bring a
nice.
stuffed animal too if you
Yes,
want.
something to kind of hold on to. He brings a lot. He puts them under his
Arm to kind of like support it.
Yeah,
because I don't really like to move it when the infusion is in it. So they're kind of there to just support it, and gotta bring my stuffed animals.
Yeah, so he usually have one behind his head, and we've got one positioned under his other arm, and so those are really good to bring for support and bribery.
That's a good one.
Yes, something Mason knows well, and I think all of us parents, IBD parents, have been here at one point or another with, it might not even just be needles, it might be other things that they have to do or procedures, but I look at it as
a reward if you do good.
Yeah, a reward. Let's rephrase bribe to a reward.
A reward, yeah.
Sounds way better, but it's true. It's a reward. So it's an incentive for him. I just basically, if we can get the IV in, however we got to do it, we get the IV in. If we're able to get the infusion, what do you want to do after? What do you want for lunch? What do you want special? We'll do something special. And at one point it was also, this is funny, but on Tuesdays, locally here in San Diego, we have a farmer, like a local farmer. Yeah, and he delivers
farms.
Yasukochi Farms. And they have a farm box. And so for our area, it was delivered on Tuesdays, which was always Mason's
infusion
days.
So whenever we come home from the infusion, we get our farm box.
There was a farm box on our.
First, I'm excited to get vegetables.
It's really cool. They have such good produce and fruit.
It's really good there.
And it was always fun because you're like, okay, what are we gonna get? So it was kind of a fun surprise.
Kind of like just a magic box.
Yeah. So that was for a while. That was something that he would request. He would ask, make sure we have a farm box that's gonna be coming on that day. So so shout out to Yasukochi Farms.
Yeah. Once again, we're not being sponsored, but they're a very good place.
Oh, but they were, brought Mason a lot of joy during a lot of hard days. So stuff like that, things for you to look forward to after, to get you to focus on beyond the moment and focusing on this painful needle. It's like, let's focus on what do we do afterwards. So I remember I would get like a little gift and I would wrap it and I would surprise you.
Oh yeah.
Center. So I should remind you of this because you're like, hey, wait a minute.
I want to do it again. Well, you reminded me.
But I would wrap up something. I would order something, nothing like super big, but something small and something fun that maybe had his eye on or something I thought was, whatever. And so he would get it there and it would be something fun for him to unwrap and to look forward to. So as soon as we bring treats for the nurses, and so that's a good distraction too. We bring things and we all
here's a treat. I know you're gonna give me an injection, but here's a treat.
Mason looks at it as a bribe for the nurses, so
they'll do good
too. But no,
they'll do good.
They'll do a good job, but it makes it more fun. But Mason does joke that you don't get a cookie.
Yeah, you don't get this cookie if you don't give me a good one. Nah, they still get it. I don't care.
You don't get it, but no, but it's kind of a joke, but bribes are good. Reward systems are excellent for this sort of thing. And also just something as simple as holding their
hand,
hand. I
yeah.
mean, I think adults can relate to
gives
this
comfort.
too. Yeah, it's like so if you need to bring a friend or bring a family member or someone, it's just nice to have someone there holding your hand, comforting you as you get through it. So that's really important, something really easy that you can do. For Mason, we had a therapist for him.
Yeah.
Because of IBD in general. So we already had a therapist. And so we decided to ask the therapist about his anxiety with getting injections. And one of the things she taught him was box breathing. Yeah. And so box breathing, we can, like, not that we're therapists,
Yeah.
but we'll explain it to the best that she explained it to us how it works. So it's like you make
you make a box with your
box.
hand and you breathe every time you hit.
Right. So
corner.
with it, you'd start off by you inhale to the count of
Yeah.
4, you hold that for the count of 4, exhale to the count of 4, hold that for the count of 4, and repeat. So over and over, and you just keep doing that. And that's to keep you breathing evenly, because I think part of the problem that happens is you start to hyperventilate, and if you're not concentrating on that. So by doing that box breathing method, it keeps you breathing evenly, kind of like with our counting.
Yeah.
Keeps you focused on breathing.
Else.
And the breathing is so important, so you don't lose control. So that is something that you could do, or talk to your therapist and see what they recommend. But that worked well for Mason. And also the other thing is just time and repetition. And just over time, it's been 3 years for Mason, and
I've just kind of gotten used to it.
And they did tell us it would start to normalize. It would become more of a normal. And so, yeah, while he is still, you never look forward to an IV or an injection.
But it's not like I'm counting the weeks.
Right. You just go, you know, it's going to be.
It's like, oh, today's infusion day.
Yeah.
Let's go.
Yeah.
It's going to help me.
So just keep that in mind with your kids, and to give them the grace of getting through that first anxiety, those first shots, first IVs, because it's going to be a little bit of a journey, but eventually you get there. And yeah, it's for us, we're in a much better place. And for me as a caregiver, I am, because I feel much more calm going in there. I'm very happy that
I'm happy.
Yes, I'm very happy knowing he's happy. So it's a relief. And but we're always, we also wear, like, this isn't part of it, but we wear team shirts. So we always go in as a team.
We got a team.
And yeah, so we approach it like he's got support. So that's the main thing for him. A big thing for him is support. Also, something you can do, you can tell the nurse that you have a fear or a phobia.
They can try talking to you.
Because like we've told Mason, I've told you this several times. I'm like, just tell them, like, tell them that you're afraid.
They can understand your fears, so they can try to help.
Yeah. Right. Or bring someone else to hold you down. So that, I mean, that's kind of a joke, but either. But yeah, the first few, they do have extra nurses that can help keep the situation under control. From a caregiver standpoint, you'll be grateful for that, because you don't want them getting hurt or anything happening. But yeah, it's good for the nurses to know what they're dealing with, and maybe to talk you through it. And like once she even went and got a vein finder, which was really cool for me. It was
really cool.
Yeah, it was like
this light. And they shine it on your arm, and it makes your vein like glow a different color than your skin.
You can see it all.
It was weird.
It's very like Halloween.
It only came out once, so maybe they'll bring it out on Halloween. That'll be fun.
Yeah, so they use that, and those are good if your child has a hard to find vein. If it takes several pokes to get an IV, you can ask for a vein finder, and those are pretty cool too. So
thankfully, the nurses at our hospital are very good.
They've done a really good job. So hydrate too.
Hydrating is very important.
A lot of water before you go. That is also very important to keep your veins nice and plump and
big
ready for
Yay.
So yeah, that's big too. So make sure you're very well hydrated too. But never underestimate telling a nurse. Like don't worry about telling a nurse if you're afraid. They would probably rather know what they're dealing with, and they can help walk you through it.
They want to help.
Yeah, that's what it's all about.
They don't want to give you an infusion, hurt you.
No, they don't. That's a sad part. I'm going, man, what a job, huh? It's like, because afterwards he would be like, Mason was like, he did not like them. But then afterwards, it's like, you're my best friend. He's like, I just love nurses and doctors, and you're all, super, super nice. So he was always polite to them, but he was so scared. And so now it's just like piece of cake, but easy for me to say. But the other thing I want to go back to just before we end this, because we're just about done, is just talking about the importance of therapy. So your child or you as an adult, all of these things that we just told you about are like, yeah, that's not going to work for my kid or my situation. If you know it's more severe and you think that your child is becoming anxious or having even depression or other issues because of this, and even if not, even if you're just curious, maybe the fear is something more, maybe it's a phobia, get a therapist. And you should have a therapist anyways. If you have IBD or any chronic illness, you should have someone set up because your mental health is equally important to your
As your
physical health.
Yeah.
So for us, it was important for Mason to get over this aspect, or if he couldn't get over the fear, at least find ways to approach it that would help him, because that could make him sick. Stressing out about that too. So
stress isn't healthy either.
no, it's not at all. And so you kind of have to figure out ways to go around that. And therapy is a great way to do that. So they might use, like, from what I read, they have things like cognitive behavioral therapy, exposure therapy, and sometimes even medication. Sometimes people need that extra step. So it's all about what gets you through it and keeps you calm. And for Mason, I think really time has just helped. It's just been, so just know that it will get better, and do what you need to do. Contact a therapist, and otherwise try some of these methods we talked about, and hopefully it'll help you guys. So
it'll help.
Yeah, because
that's what we want.
He definitely was a high fear. Yeah, because sometimes in the infusion center, some kids walk in, you hear them they get situated, and they get their IV, and you don't hear peep out of them. They're like,
they're just chill.
Yeah. Other ones scream the entire time.
It's sad.
It's really sad. It's hard to hear. And so Mason was somewhere in between that. And so he's definitely adjusted. And I know a lot of adults are like probably thinking, you're probably not screaming like a kid or acting like a child in there, but maybe you want to. So hopefully you heard something here. If you have a technique that you use that you want to recommend, go ahead and throw it in the comments. Yeah, it would be great to put some extra ones in there and add to it, because again, this is not all of them. This is just some of the ones we use. And I'm pretty sure there's other ones that as Mason gets older, there'll be new creations and all kinds of things. So anyways, that's it today for our fear of needles. And hopefully we've given you something that will help you guys. So you can follow us on Instagram at Team IB Determined, or you can message us on there. You can leave comments. We do post our updates on there as well. And you can follow us on Spotify, Amazon Music, Apple Music, and iHeartRadio if you want to listen. If you prefer to watch,
you can watch us on YouTube. If on YouTube, don't forget to leave a like and subscribe. And if you want to be notified whenever we post a video, hit the bell. Don't be afraid to comment either. We don't get that many comments, so we'll definitely read them.
We say this like every week, so we mean it. And last week we actually did get a couple comments. But
so
we also talked about Disneyland.
So that's probably why I do.
Don't
forget an exciting topic.
So we saw you guys, we responded. Thank you.
Thank you for commenting.
Please do that again. And if you are looking for us, you would just search IB Determined on YouTube or on any of those other podcast stations I mentioned. So just you can find us there. And we hope you guys will stay tuned for next week's episode, where we'll be back to talk about more IBD.
Fun,
surprises. Guys, hope you guys have a great day, evening, morning, whenever you're listening to us.
Great today.
So you guys, thanks for listening.
Yes,
thanks for watching.
And we'll see you in the next video.
Bye.
We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to apply something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.